Hello, I'm Kathy. I'm a midwife, IBCLC and tongue-tie practitioner. I'm going to talk to you about some exercises to do after your baby's had the tongue-tie release. So, the very best exercise is feeding. So breastfeeding or bottle feeding. Make sure you feed your baby at least every 3 hours for the next week. And that will encourage the wound to heal as it should do. And it will encourage good movements for your baby's tongue. Add into that at least 6 times a day doing 3 exercises. One is to tickle the front of the baby's mouth, so the top lip and the tip of the tongue will encourage the baby to stick their tongue out. One is to put a clean finger in the baby's mouth and run it along the lower gum one way and the other way and the other way, and do that a few times, and that will encourage the baby to move their tongue sideways. And the third is to encourage the baby to suck your finger, and then you gradually pull the finger out, and they'll try to grasp it back in again, and try to pull the finger out, and they try and grab it back in again. Try to pull it in and grab it back in again. So you're playing this little tug of war with the baby, and all those muscles all that will help to strengthen your baby's tongue muscles in different directions. They may not do it particularly well to start with, but it's important to do those exercises because it helps the baby to use their tongue to the full extent that they can. Thank you. I'm now going to show with Milo how to do that. So the first one is to stroke gently the front of the mouth, and then if we can just tickle the front of the tongue, it encourages the baby to stick their tongue out and root and try to bring their tongue out. So at the moment he has quite a significant tongue tie, so he's not actually able to do that brilliantly, but after the procedure these exercises will help to him to have much better range of movement in his tongue. So just a few times like this, encouraging him to stretch his tongue out forward. So that's the first exercise. The second exercise is to get a finger on his gum ridge, the lower gum ridge, and we're going to rub one direction to one side and one direction to the other side. And that is actually going to encourage him to follow my finger. So he's going to try and follow my finger as an instinct, and that encourages his side to side movement first. He's a good boy. There we go, and again just a few times. And then the third exercise is to get him to suck a finger. Oh, I'm going to use a little finger. Suck a finger, and when he's got sucking, I'm going to just, oh dear, he's got a very strong gag reflex. Just one little shot. That's a good boy. And once he's sucking, just try to gently remove the finger, and he'll try to grab it back in. Babies often do this at the breast, but especially if you've got sore breasts, you don't want to be doing that. So when you try to take the finger out, you'll hopefully try to grab the finger back in again. So you're playing a little tug of war game. Ooh, there's a good boy. Oh, and all these movements will help the tongue become more active where it's been a bit tethered, and it will also mean the movement will make it less likely for the tongue tie to stick itself back down to get back there. There. Thank you. So for some babies, the improvement in feeding is immediate after the tongue-tie division, but for some babies it can take a few days. If you find that nothing's improving and you're not seeing any benefit, please do contact somebody sooner rather than later. If you find that the improvement has happened and everything's going along really well, and then you find 1 or 2 weeks later things have gone backwards and you're getting the same problems that you started off with, do contact your tongue-tied practitioner, because that could be a sign that there is a reattachment. But yeah, please seek help if the feeding is not comfortable and happy. So once your baby's tongue tie is released, what normally happens is the tension is taken away, and so the tension is released in 4 directions, and you end up with a small diamond-shaped wound under the baby's tongue, and that's a good sign because that means that the tension is all released. It also means there's a little tiny open wound under the baby's tongue, and we want that to stay open, and we want that to seal itself across and heal over. So that's where doing all the tongue tie exercises, feeding the baby nice and frequently, will help that to stay open and heal properly how we want it. Sometimes as it's healing up, it will have a whitey yellow look to it after a day or 2, and that's perfectly normal. You can see pictures of that online or in your information leaflet, just because it's a very normal thing to have this rather strange looking yellowy white ulcer under a baby's tongue after they've had tongue tie divided. If the baby gets an infection, again extremely rare, everything would look red and angry, there'd be pus coming away, your baby would probably be unwell and have a fever. So if you're at all worried, take your baby to the GP who can prescribe antibiotics. But do let your tongue-tied practitioner know if you suspect that as well, because it's important that we keep a record of these things. So, if you notice any bleeding later on after the tongue-tie division, the very best first aid is to actually feed the baby. So put the baby to the breast, give the baby a bottle, let them suck on a clean finger, because sucking is what will settle down any small amount of bleeding. If you find that that's not working, the next best thing is to put some pressure on with something clean. So what I recommend is either a little bit of gauze, if you've been given spare gauze, or the corner of a clean muslin square. Don't use anything fluffy because you don't want to have bits stuck in the baby's mouth. So this is the tongue, this is the bottom of the mouth, and any bleeding will be coming from underneath the tongue in the middle. So that's where you need to just put some pressure on with a clean gauze or muslin square and call 999. That's extremely unlikely to happen, but this is just so you've got a backup plan in case it does happen. Sometimes you'll notice there might be a little bit of pink in the baby's vomit if they're a bit sicky later on in the day, and sometimes the nappy will have black specks in, and that's if the baby has swallowed a little bit of blood during the procedure. It's extremely unlikely to happen, but we just want you to know what to do if there's a problem.